Hi guys, I'm here with a pretty incredible guy called Dr. Thomas Incledon here in sunny Arizona, in Phoenix, or near Phoenix, Scottsdale.
Yep.
And flew in from LA yesterday because I really wanted to meet this guy because I heard he's got a pretty amazing track record of helping guys increase testosterone naturally well into their 90s, which is pretty staggering. And I've also found out that he does some pretty incredible stuff in the way of natural healing, which fascinates me. My second book, which is called The Vitality Secret, is all about chronic inflammation. Now, Dr. Thomas Incledon may not be wearing a white jacket, but he is a doctor. Mm-hmm. In fact, he's got about five degrees, have you?
Yeah. So I have a PhD, and I did go to med school, so I got exposed to a lot of stuff that physicians do. But really, I was trained more about doing research and study designs than I was on healing people. But I just thought the way the direction healthcare was going, they're missing the boat. You know, they're taking people apart, everybody's specializing, and they're missing out on the fact that, well, how are we going to put these special pieces back together? And there's all kinds of gaps and things. And so I decided we got to do something different. I created a center to bring other bright minds here and basically work as a team.
Amazing. And you've got people who fly in from all over the world to be treated when doctors or Western doctors typically say there's nothing more that can be done.
Yeah, so I mean, here's the thing, the model I set up, imagine you got all these top docs working together to help you, and no one's ego is getting in the way, and everybody is geared towards getting a positive result. So when you have, leadership and focus and direction, you have just really cool stuff, amazing things that happen. And what I see a lot of times when I look at, when patients come in, their medical records, we're going through their charts, and you see one doctor saying do this thing, another doctor saying doing the exact opposite. Well, there's no wonder why the patient can't get better, right? Because there's too much conflict in their care.
Yeah.
So there's no way. It'd be kind of like, imagine if you had 4 flat tires, and every mechanic that was, trying to repair the tire or put air in it was doing something different.
So there's almost like a conflict between the different doctors rather than a synergistic effect.
Yeah, they're not working in synergy. They're working in it's like antagonizing ways that just interfere with the end result. And of course, that doesn't help anybody. It doesn't help the doctors to learn more. It doesn't help the patients get better.
And it's not necessarily their fault, is it? Because they're given like 10 minutes or something to see a patient, and they're given the training, whatever the training is. Unfortunately, it involves very little nutrition training, doesn't it? I mean, I've heard about a matter of hours in a 6-year program. So they know what they know, and they have very fixed time periods in which to see people.
Yeah, so the sad thing is, healthcare now is evolving where the doctor spends maybe on average 8 to 15 minutes.
Wow. And
there's no way you could really figure anyone out.
Yeah.
And the mistake that patients make is, one, they put up with it. So if someone does something and you allow them to continue to do it, then no wonder why it keeps happening. And what patients need to do is say, okay, I'm taking charge of my health, and I'm going to decide who I'm going to hire to help me.
Yeah.
And then if a patient says, I'm not putting up with a 15-minute consult, then the doctors have to rethink their strategy, or they don't have patience. And then, the doctor rethinks the strategy. Basically what you find out is insurance is not really helping anyone. It's harming people.
Yeah.
It's harming people because someone else gets to decide if what they want was medically necessary. That makes no sense. It's your right to do whatever you want.
Right.
Why should someone else be determining that for you that doesn't know you, hasn't even seen what's going on?
It seems very skewed in the wrong direction.
Yeah, definitely is.
Yeah, so I'm all over natural health solutions to pretty much everything there is. Any kind of illness or disease, I firmly believe is.
Well, so what's really comical is we do a lot of stuff with exercise and nutrition, and that's viewed as alternative, and it's viewed as complementary. We're providing people with substances that they need to live, How is that alternative or complementary, right?
You're alternative because you're living like a human being and you're moving your body and eating what nature puts on this planet for a reason.
Yeah.
Therefore, you're alternative.
Yeah, but shouldn't drugs be alternative?
Right.
So you see that there's just a total, it's upside down, you know, or backwards, I guess. The way the laws are about what's a food versus a supplement, the way that, drugs are not perceived as alternative, even though they don't occur in nature and natural stuff is considered alternative, that makes no sense.
Yeah.
But I think, more people getting educated about, things like that, their awareness of things like inflammation is improving. So they're becoming more aware and they realize, okay, I can't just do the old school medical way. It's not going to help us long term.
Yeah, I think people are slowly cottoning onto that, aren't they?
Yes.
There is a natural remedy for almost everything. Fascinating. I mean, inflammation has been dubbed as like the foundation for pretty much every single chronic disease and illness. Can we talk about that for a second? I mean, my understanding of inflammation is it's your immune system's response to what it perceives as an attack on it. So it's a consistent intake of stuff that we really shouldn't be taking in, and your immune system goes, whoa, what the hell's that? And plus you're not moving your body, which helps to fight inflammation. And typically we're undernourished in the Western world with micronutrients from plant-based foods, which are excellent at tackling inflammation. That's my understanding of the whole kind of chronic inflammation that happens beneath the surface. I mean, acute inflammation, you get a knee injury or the knee warms up and sends all these funky fluids to it, and then it creates pain, so it heals. So it's acute inflammation. But the chronic inflammation is what you can't see until it's often too late, like with a heart attack or a stroke or something like that.
Yeah.
Can you build on that at all?
Yeah,
I'm sure you can.
I would say, a couple of things I would say, though. I would expand your personal definition to be a little bit broader because I think inflammation can come from more cells than just immune cells. It could be chemicals from the environment, per se. Also, I think if we were to boil it down to like a common element, it appears that there's some aspect of like free radicals, or there's some other molecular component that when it's present, it creates damage. And that damage is at a molecular level, so it's much, much smaller than a cell, but it continues to build up and build up and build up, and then it starts to damage or interfere with functions of cells and tissues and things like that. So as an example, glucose can be inflammatory by attaching to a protein and then interfering with how that protein works.
Yeah.
So, you can almost make the argument that excess anything could be inflammatory, because of the fact that the body can't process it the way it should or deal with it. You can make the argument that when people have low micronutrients, they're more prone to inflammation.
Yeah.
So it's a really big category or big area, and traditionally. A lot of ways substances are discovered, they're typically discovered with a certain disease and they're kind of labeled. So a lot of the risk factors for heart disease, when they're originally discovered, they later on found that some of those same substances, they also occur when there's cancer, when there's an infection, when there's cartilage inflammation. In other words, they're not just specific for heart disease, but they're still maybe labeled or characterized that way. And now certain labs like Cleveland Heart Lab and some other labs have a big reputation, well-renowned reputation. They're now moving away from categorizing them like cardiovascular risk factors to just basically inflammatory markers.
Yeah, like C-reactive proteins and
Exactly.
TNF alpha.
Yep.
Yeah.
So like CRP, for example, it's a common one. Originally they thought it was if you have high CRP, then you have a high risk for heart disease or heart attack or something. And then they found, well, it's also high when people have cancer. It's also high when there's an infection. It's also high when there's arthritis. So it's really, an inflammatory marker. It's not specific for a disease.
Right.
And so there's been, attempts to try to isolate certain cytokines and other inflammatory substances to see if they correlate with certain diseases. But what my experience has been after looking at lots of testing of people, as things move from acute to chronic in nature, so you have chronic inflammation, you start to see like a little bit of everything is high. You know, it's not just like one thing. And you know, the thoughts are that these substances are traveling around the body and creating damage in multiple locations. You know, not just like your hip or just like your knee, but everywhere.
Yeah. Wow. What would you say are some of the biggest culprits? I mean,
Of inflammation?
I've read a lot up on grains, for example, and particularly in America, the quality of the grain is really poor. But going back 10,000 years or so, that's when the agricultural industry started. So a lot of us, I read in the Primal Blueprint, I think Marxists said that about 65% of the population is actually intolerant to grains in some form or another. In Grain Brain, which I've just read, an excellent book by Dr. Perlmutter, he talks about there being 3 or 4 anti-nutrients in grains which cause inflammation and also lead to Alzheimer's and various neurodegenerative disorders, all from the grain. I know for me, I mean, when I read the Primal Blueprint, I pretty much came off grains, and I found it so much easier to stay lean. Because not only do they contain anti-nutrients, but they're very high glycemic. In fact, some grains I think are higher on the glycemic index than sugar. So you get that insulin shock, and then you're more prone to storing fat.
Yeah, well, I can say I definitely agree for some people that certain foods can be inflammatory. You know? But I think the danger of just like just saying say grain for everyone is that on an individual basis, it's possible, for example, that let's say coffee is worse for you than grain.
Interesting.
Or maybe some other food. And so what you would really want to do, if you are, you know, if you want to be personally responsible and take in charge of your own health, what you really want to do is find out what foods affect you the most and then plan your diet around, you know, avoiding those foods. But another thing to think about is, you know, now that we have the human genome, so you can do whole genome testing. Now we have microbiome testing. It's no longer acceptable to lump us all together and say, you know, we're human, or we're all men, or we're women, or something.
So you go blanket and treat everyone and say all the same.
Yeah, because now we have more details than we had before. And if you are truly concerned with helping the individual, you got to really understand the individual. And here's where you see just so many unique things, you know. So I would say, like, you know, general stuff, if you want to reduce inflammation, let's say, eat a wide variety of fruits and vegetables, you know, maybe eat leaner meats, or if you're going to eat fattier meats, maybe make sure they're grass-fed or something, right? Because there's a different effect. A grain-fed animal has a different fatty distribution.
Yeah, I heard that wild salmon is one of the most anti-inflammatory foods you can have, whereas farmed salmon is one of the worst that you can have in terms of inflammation. I read that in Inflammation Nation, actually. But I found that really interesting. It goes to show that, and some of these grains are GMO as well, aren't they? When they're fed to fish, they're genetically modified, so it's playing God again, and that causes more of an inflammatory effect. And then, like, the same goes for any kind of animal, the grain fed on soy oil.
Yeah, you know, so there's different aspects. So if you have your general sort of information, you know, to be like, you know, everybody should, let's say, eat wild, you know, meats and stuff. But then, you know, after that, you have the individual exposure, and it's like we had talked about earlier about, you know, you might say everyone should eat blueberries, strawberries, and spinach because they have rich antioxidant components. But then in certain parts of the world, because of chemical exposure in the soil, those same food crops might be, you know, they may have a contaminant that you don't want to put in your body. So you might say, in this region, United States, or in this country, etc., you know, avoid the blueberries, the strawberries, the spinach. And then if you were to test someone and find they have an allergy to those foods, you might say you need to avoid this period regardless of where you go, you know. So you kind of have to temper your answer with an understanding of the individual and what the environment is and what's going on inside them. But I would say one of the easiest ways to reduce inflammation is a wide variety of fruits and vegetables. Even if they had, you know, pesticides in them, it's still probably better to eat it than to not eat anything at all, you know?
Yeah, it's good to know, because some people have put off organic because it's just so expensive at the moment. So it's good to know that it's better to eat vegetables even if they're contaminated than to not eat them.
Yeah, well, you still have to live.
Yeah.
You know, and if there's no energy, you can't survive.
Yeah.
You know, so you would die sooner from the lack of energy than you would from the chemicals. You know?
Yeah.
So I'm not saying we want chemicals, we want to avoid it if we can. But
Yeah.
if you've got to, in terms of rationalizing in your head, you're not driving yourself crazy. You know? The other thing to think about is, you know, there's probably ways we can quantify, you know, how different behaviors and different decisions people make result in more inflammation. But one is like sleep. You know, across the board. So as an example, men, even when you're injecting testosterone, if they're sleep deprived, they could still have loss of erections and libido issues.
Right.
So the reason why I share that is because everybody knows testosterone is powerful, right? It works in so many ways, but sleep is so much more powerful that if you don't have enough, it overshadows the benefits of the testosterone.
Because of all the hormone regulation that happens during sleep and growth hormone, etc.
Well, there's so many things that happen,
Yeah.
and one of the things that really got my attention is chronic lack of sleep results in the increase of an inflammatory marker called interleukin-1 beta, and that messes you up all over. You know,
Wow.
it tends to affect glucose control. It tends to affect pain and swelling around the body and things like that.
Wow.
Yeah.
Wow. It's good stuff. Good to know, I mean. So yeah, tons of micronutrients, tons of vegetables, fruits and vegetables. You were saying earlier you prefer the whole fruit in a blender rather than juicing because you get the fibre. I have heard that the argument for juicing is it's because the fibre's taken out, it's absorbed much quicker into the bloodstream. What's your view on that?
Well, but we have to prove how is that an advantage. You know? So one of the dangers, so like in general, if we had a conversation, we might say we want to get nutrients into the body faster, right? It sounds like a good concept, but the thing to keep in mind is, let's say here's like your blood level of any nutrient. Now when it gets in faster, the level rises rapidly. Well, now what can happen is that there are filtration mechanisms in the kidneys, and it may rise so quickly that it turns on these filtration mechanisms in the kidneys. So all you did was it goes in quickly, but then you filtered out faster. So you don't have a net gain in the tissue. So what you really want is at the cellular level, you want to show more of whatever nutrient it was that you were ingesting, more of that nutrient got to the cell. And there's been some really good like calcium, I would say look at some of the research on calcium metabolism. Some of the guys in that field, they're very sharp and savvy. What they found is certain supplements, you know, like the dietary supplement companies or the manufacturers, they focus on, hey, this great absorption. But they don't tell you the rest of the side of the story. And what they leave out is, yeah, but it also, you urinate it out very rapidly.
Okay.
So it doesn't stay long enough to actually get into your cells.
Right.
So if it doesn't get into your cell, there's no net gain for you. There's no tissue. It's not like a true tissue change of that nutrient. So, you know, so in general, yeah, we want to absorb things well, but really what we treat, the expectation, if we absorb it well, the expectation we'll have as consumers of food, or supplements, whatever, is that it gets into our cells. So when you now look at the whole process, now your perspective changes a lot. And then it's like, well, what's the best way to get it in me so more of it stays in me? Right?
Yeah.
And that's the part where there's a lot of variability. And I think that's kind of, I think from that respect, that's really clever about nature, that the fiber slows it down, so it's not like a shotgun all hitting at once. It tends to come in more stable. And guess what? With that type of approach, more that gets into the blood gets utilized. You know?
Interesting. Okay.
Yeah, it's, I mean, granted, once stuff is in the blood, you have all kinds of ways where some nutrients bind to proteins that get moved around the body. Certain nutrients, there's active and passive transport across the cell membrane, you get things like that. But in general, if it gets in too quickly, you run the risk that it might be urinated out too quickly.
Okay.
Yeah, B vitamins are a good example. Too much too fast, and you can see your urine change color right away.
Right.
What that means is, yeah, it went through you.
Yeah.
Went in my mouth and it leaves you by the urine.
Right.
And so there's no way to know for every person, you know, exactly what amount they should start with. But what we do is, we use the dosages that are discovered through research studies to be effective, and then we test people and see what they have, and then that's how we know how much to give them and so forth.
Okay, very good. I know your time is limited, so we can wrap it up. You did mention in one of these supplements, the Renew Male one, which I'm going to try.
Yeah.
What's the ingredient which is anti-inflammatory in it?
So, the rhodiola rosea,
Yes.
and the mucuna pruriens and the uricoma that are in there, the uricoma longifolia, they have components in them that have like antioxidant type activity.
Amazing.
And antioxidants in general, they fight free radicals. And anything that fights a free radical, that's potentially an anti-inflammatory type of substance. What I like about that particular formula is that at a cellular level, the cells can handle stress that much better.
Right.
So the implication then is like in the face of inflammation, in the face of stress, the cell still holds up okay.
Does it fight cortisol then?
Yeah, it does lower cortisol.
Right. Wow. Amazing.
Yeah. So and keep in mind, what's interesting about that is it doesn't take a guy that's normal cortisol and put him in the basement.
Yeah.
It takes a guy with high cortisol and makes him normal.
Right.
And if your cortisol is already normal, it doesn't go down any further. So it might be better, rather than saying it lowers cortisol, it might be better to say something like it provides like a healthy cortisol response.
Okay.
It helps with healthy cortisol response because like when you're stressed out, you want cortisol and epinephrine and hormones to be produced. That's part of how we react to things.
Yes.
So you don't want to be like, you need to move and your body's still very calm and nothing's happening. Like you need to move, you want things ready to go. Or if you want to work out, you want to be ready to do it. You want to be like, oh, I'll get around to it, just want to be effective.
So cortisol has a function. It just needs to be,
needs to be tempered.
Yeah. Excellent. I'm going to try this. This is called Renew Male by AHI. And I'm going to put a link beneath the video. I suggest not taking it if you're a woman. It's for testosterone, increasing testosterone naturally, with the added benefits of getting rid of inflammation and managing cortisol. So I'll put a link below the video for that. In short, some of the best ways to fight inflammation: plenty of fruits and vegetables, take out toxins.
Well, get plenty of sleep.
Get plenty of sleep.
Yeah, definitely avoid toxins if possible. But
like 90% of the supermarkets.
Yeah, it's tough because you don't know where it's coming.
Yeah.
There's so many vendors. It's like saying, I got 1,000 guns, firing bullets at you, and you're going to stop this one. It's still a lot of damage. So I think the sleep and the colorful fruits and vegetables in the diet. I mean, if everybody did that across the board, we would see huge reduction in all kinds of diseases, like even pain.
Talking of pain, I met a gentleman in Mammoth earlier this year who had been grain-free for a year. We started talking about what I was doing for business. And he said, I've been grain-free for a year and I'm never going to touch another grain in my life again, because he said he was suffering from IBS, which he had endured for 43 years. His doctor just kept on putting him on different medications.
Oh, yeah.
And he actually read Grain Brain and decided to come off them. But he said not only did his IBS just disappear, he said he could think more clearly, he's more motivated because he didn't suffer from Grain Brain. He said he had more energy than ever before. He said his joint inflammation had gone, just disappeared. He's a ski instructor, so very active, but he had inflammation in the joints, that just disappeared. And he also said his eyesight got better. I mean, that's insane, just from taking out grains.
Yeah, but think of it this way though, if let's just say he's got, so certain people have a genetic predisposition, in their family ancestry, their lineage, that they have a gene where there's definitely some effect of, wheat type products on their health. And assuming it's, a pro-inflammatory agent for them, then that inflammation, remember, it's all over their body. So it's every joint, it's every cell. It's getting hit with it. So brain, vision, taste of smells, other senses, it's all being affected. I'll say this: when people eliminate something that's, let's say, a negative stressor for them, we see it all the time. Some simple things I've seen with respect to pain recently, people just changing their bed. I actually had a conversation this morning with a guy where we were both joking, you know, if we went back 20 years ago, and I said to the guy, hey, I'm gonna spend $10,000 on the bed. Like, oh my God, that's expensive. It seems absurd. But now you start thinking, well, I spent 1/3 of my life in this surface, you know, and if it's the wrong surface, my alignment, my spine's gonna be off, my shoulders, my neck.
It's making me think about changing my mattress.
Well, but then all of a sudden you start thinking, and we've tested this with people, changing their bed, and literally they'll say their neck, elbow, you know, hip pain disappears. I've tried it on myself. I had something going on with right by my scapula, and basically I felt it was like a nerve that got inflamed, and it started progressing up and down. So you could almost say like the left side from the head down. And I'd see different buddies of mine that are like neurology and chiropractic, and they'd work on it. And it would feel better for like a day or two. So you get massage, feels better for a day or two. We'll come back, and I'm like, what's going on? And then one day, I was traveling, I slept on a really firm, like super firm mattress. And I didn't plan it that way, it just worked out. And I woke up the next morning and I had no neck pain, nothing at all.
Oh, wow.
And I'm like, what the heck is that about? And I'm thinking maybe it was the environment. Like at first I was thinking like maybe I had an allergy here that I didn't have over there, but I'm like, I don't have any watery eyes or runny nose or none of the allergy symptoms. So then I said, let me test something. So in my house, I have a massage table. When a massage therapist comes over and works on me. So I set up the massage table by my bed and I just slept on it. So I'm in the same room basically. So the environment's the same, sleep on the table, and I have no pain the next morning. And I'm looking at my bed like, I can't believe that. So I replaced the mattress and we went up, we did some research, we got something that my girlfriend and I were very comfortable. You know, she wanted something a little bit softer, I wanted something super firm. So we got, both sides are separate, but they're sealed together. So that way there's no seam between the bed, it's one solid piece. But I have the side I want, she's the side she wants.
So you don't interrupt each other.
And we've been pain-free, well, I've been pain-free ever since. And the interesting thing I'll point out is I could train harder with less aches now. The other thing I noticed is strategies like treatments that didn't work before, they now work well on me. And you know, so I think there's something about whether the mechanical position I was in, something was rubbing and inflaming my body or something, but it was definitely a mechanical position situation. With that happening repetitively, my ability to evaluate if something would help me is compromised. It's like contaminated, right? But I don't know it's contaminated because I didn't know the problem was the bed. So these are things that, you know, when we talk to clients when they come in, we start with simple stuff. Let's look at how you're sleeping. You know, are you comfortable? Can you sleep all night without tossing and turning? And then we measure how can they breathe, they have good airflow. And when you click simple data, you know, down simple things like that, you find almost everybody's got an issue. A lot of people, especially entrepreneurs, they either can't turn their mind off, so they have insomnia.
I have that.
Or they have sleep apnea. And the thing is, so I think that's where meditation, we really talk about that.
I'm really looking into meditation now,
So think about this, there's some really good books by some doctors from Harvard. And you know, there's like, it seems like on paper all these kids are being diagnosed with ADD, ADHD, and stuff like that. And essentially what some of these guys have said is, you know, it's not that more kids are getting ADD. It's that socialization-wise, think about now on your cell phone, you got texting, people could email you, you got all this technology in your face.
It's constant distraction.
Right.
We're living in an age of hyper-distraction, aren't we?
Right.
It's being called left, right, and
Right, so at young ages, we're teaching kids how to bounce around.
And our brains are designed to unitask, not multitask.
Well, but the thing is, but from a school educational perspective, we're conditioning children at a young age to bounce around. Then we send them to school and they're told, focus on one thing. But they're only in school so many hours a day, and the majority of hours a day they're being taught to bounce around or look at everything, you know? So we're basically sending kids mixed messages, and then we're penalizing them for doing what we've conditioned them to do. So it's not really fair. So definitely there's got to be some change in the educational system.
I think there's a lot, I could talk for hours on ADHD. It's a fascinating topic. Ultimately, I think exercise is one of the best ways to combat it.
Absolutely.
Many of the drugs just stimulate the wrong kind. They have side effects, stimulate the wrong neurons, nerves in the brain.
Yeah,
and,
neurons.
Yeah, and most people suffer side effects. I've tried it a few times because I suffer from ADHD, but when I go and run first thing in the day, or if I walk around on the phone, I can concentrate. When I'm sat in front of my laptop, but I can't concentrate. So yeah, I think it needs to be active to really.
I don't know when the next time they'll be back, because I know you got some travel plans coming up. But at some point in the future, after you give this a chance to evaluate this and see how it helps you, I'll share with you some cool stuff we were doing. When you exercise, you increase nutrient delivery to your cells, right? Because blood is moving faster. So given that, there are very simple tools where people can take certain amino acids or certain other substances, and this is all natural stuff, but they take them before light activity. And now what you're doing is you're using blood flow to drive more of it to your brain. So it totally, so essentially it's like improving the effects of the supplements.
Cool.
Right? So imagine, I remember told earlier, like whatever you take, you want to get it in your cell. So what can we do to enhance that? And we've been playing around with some stuff with ourselves and some other guys where I've been really focusing on a lot of substances for the brain, because I think in terms of countering aging, in terms of maximizing human potential, the brain is where you want to be focusing a lot of stuff. And yet, when you look at program design and exercise, and look at a lot of studies that are done, they're looking at like endurance and muscle. They're looking at elsewhere in the body, but they're forgetting, well, what controls that?
Yeah.
It's the brain.
Yeah.
And basically, we have incredible communication systems between our brain and the environment that is run through the nervous system and immune interactions and other things. So if we improve our brain health, like lots of other stuff just improves. Like people tell me, I focus better and my joint pain is less. And we didn't really focus on their joint pain, right? We were just focusing on getting more nutrients to the brain. And my suspicion is that there's some alterations in various substances that are inflammatory.
Yeah.
And so, even if, let's say, like if I damage my elbow, so let's say the cartilage inside my joint is
Lifting too many cars.
Yeah, too many cars, that's right. So I damage my elbow, but somehow that signal of the damage, how does my brain know right there versus somewhere else, right?
Yeah,
so there's got to be some communications. And that means then, if we improve health of the brain, maybe that can influence that communications.
Yeah, interesting. Yeah. Having read Brain, I realised how much focus there wasn't on the brain.
Mm-hmm.
And because there's no pain receptors in the brain, you don't actually know whether it's becoming inflamed.
Yeah.
And you can get headaches and stuff and migraines, which people can alleviate if they come off grains in certain cases. But yeah, otherwise you don't know if you have inflammation of the brain.
Yeah.
So that's an interesting point.
Yeah, from time to time we do some talks at different places around the country, and I'll meet guys and they'll say, I eliminated this food, and instantly, I've met people that have said coffee eliminated, wheat for sure, dairy for some. But what I would say is interesting, and if you go to other countries, you could also find people there that maybe introduce those same foods and they feel better.
Yeah. We were talking yesterday about how in Europe and France and Italy, it's just a very, very different brain, isn't it?
Yeah, I mean, I don't have the travel experience you do and some of the other people that we know. I've only been to one European country. But just in that limited experience, the wheat products I had in Italy versus the US, they taste totally different. I feel totally different ingesting them. And I would say it's probably a good exercise for most people in the US to actually go to another country and try some foods there and try them here. Because I would never have characterized myself as having any issues from wheat, just nothing stood out. But after eating wheat in Italy, and then coming back and eating wheat, I would definitely say, wow, I definitely get more bloating.
Yeah.
I just, like after eating, I love pasta, I'm Italian, so, I grew up on eating pasta. But I think over the last 40 years, from when I was a young boy to now, I think there's been a lot of change in the wheat products,
The likes of Monsanto and all the herbicides and pesticides and all
Yeah, but something's different, exactly
Yeah.
what it is. I mean, more than maybe I changed, maybe it's the wheat, maybe it's both, right? But what I would say though is based on that experience now, I just toned down wheat consumption And whether or not, science can prove if it's harming me or not, the fact is I felt a difference.
Yeah.
I ate something here and I felt one way, and I ate supposedly the same stuff here and I felt a different way. And that's justifiable to me, to initiate change.
Yeah.
So I think for most people, we all want our own level of proof. Some guy could just read it and that's acceptable to him. Another guy wants to feel it, and another guy wants to observe it in others. That's different forms of proof. And it just, as long as you have a level of proof that satisfies your curiosity, then that gives you the freedom to make change and do something different.
Right.
And so it's there's nothing wrong with trying.
Yeah, and that's the beauty about food. You can't really go, well, it can go wrong if you have any toxins as trans fats, but everything else plant-based, and you're not going to really lack anything by taking out grains and just trying to see what happens. That's the beauty about it. We can just try and test and see how we feel. Yeah. Thank you.
Sure, man.
Dr.
Thank
Tom.
you for coming by.
Thank you everyone for listening. Again, I'll put a little link underneath this for, that's the amino acid, and that's the anti-inflammatory. Renew male if you're a woman, don't have that. Thank you. See you in the next video. I'm Neil Cannon, and this is Dr. Thomas Incledon.
Take care, guys.